Kevin, good morning.
Morning, Charlie.
I'm glad I'm glad that you agreed to do this for me for the sake of graduates of a program that you yourself graduated from years ago. You know, the topic, of course, is Invisalign, and I know that, you know, as an orthodontist trained at St. Louis University, you know, you've had long and deep experience treating many malocclusions, and I want to get your thoughts on Invisalign, especially along the lines of what especially a young, just entering into practice, general dentist, if you were them, what you would like to have learned about Invisalign early on in your training.
Well, first of all, Charlie, I'll tell you that about 5 to 10% of my practice is treated with Invisalign. Last year it was about 5%. It kind of fluctuates from year to year. Probably the most important thing about treating a case with Invisalign is selecting the right case. Okay, not everybody is a candidate for Invisalign. There are people who will try just about anything with Invisalign. But as we learned from the lecture we heard yesterday, you really should select the right cases. If you have an extremely crowded case that requires extractions, it's probably not a good idea. What I tell my patients is that we will, you know, if it's an acceptable case, say a class 1 with mild to maybe moderate crowding, I will tell them that we will treat them with Invisalign. They have to understand that compliance is critical. If they don't wear these appliances, they don't work. And for teenagers, sometimes that can be an issue. For adults, that can sometimes be an issue. I've had adult patients pay the fee and then got their aligners and disappeared.
Wow.
You know, which is, you know, yeah.
Disconcerting at best.
Yes, you really need to talk to them about compliance.
Kevin, what about, I've heard, I had a conversation with, actually it was with Jay Bowman, and he was describing to me a conversation he had with a general dentist who was using Invisalign, and as you know, there'll be general dentists around you who will want to use it, others won't want to touch it. What do you say to them about if Invisalign was the only trick you had in your bag of tricks? What happens if it doesn't work or doesn't get there? Well,
and that one of the things that I do in my office is I tell them, if we get to the end and you're not happy, we'll put braces on for 2 or 3 or 4 months or whatever it takes to finish the case properly. Now, in terms of general dentists that in my community that do provide Invisalign, and there are a few, I've talked to them and I've told them, if you ever need any help, let me know. I'll be happy to help you with it. If you have a problem finishing a case, send them over, we'll take care of it. That's probably one of the issues that would be the most concerning for a general dentist. If you treat a case and you can't finish it to the satisfaction of the patient, now what happens? But you know, and there are some cases that are not that difficult that you can finish pretty good with Invisalign. But that's one little quill in my, one little arrow in my quill that I have that I can use to finish a case if I need to.
Okay. Do you think that a general dentist who is going to do some Invisalign would be out of line if they did not tell the patient in all honesty that something along the lines of, you know, braces would be needed to get you done excellently? How would you approach or address that issue?
Well, you know, that's a judgment call, I suppose. I mean, I don't know how ethical it is. If you're going to treat a case orthodontically, you're supposed to treat it to the same standards that a specialist would treat it at. And if you're not going to finish a case as well as it can be finished with, say, traditional braces, then, you know, that's an ethical question. I don't want to be judging anyone, but you're supposed to be able to treat it to the same standard that a specialist would treat it at, and that's for any specialty, not just orthodontics.
Okay. What would be, in closing, Kevin, I really appreciate you taking the time to do this, maybe the top 2 or 3 things you'd want a young general dentist to know about Invisalign?
Well, if you're going to do Invisalign, if you're going to try to treat Invisalign cases, first of all, I would talk to an orthodontist in your community that you're friends with and ask them for advice. They're going to be more than willing to help you. Most of them will. If they're not, then you need to find one who will. Learn how to select the proper case. If you're going to start out with something simple. A mild crowding, class 1 molar, class 1 canine case. Don't pick a hard case to start. Pick something easy. And make sure you've got a backup plan. Definitely have a backup plan.
Okay. Kevin, thank you so much. I appreciate it.
I hope it helps.
I'm sure it will. Thank you.